Good afternoon, Larry Homez. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities, both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. You can now start your role play.
Good morning, Mihiraa. I'm Larry Homez, one of the nurses here at the clinic.
Good morning, Larry.
Mihiraa, I can see you're looking a bit concerned after receiving your blood test results, and it's completely natural to feel a little overwhelmed when you get a letter like that. Please rest assured that we are here to support you through this. To start our discussion today, I'd like to explain exactly what these results mean for your health. Your blood work shows that you have high cholesterol, which is a type of fat found in your blood. It is important to understand that there are two main types: bad cholesterol, known as LDL, and good cholesterol, or HDL. You can think of bad cholesterol as something that builds up on the walls of your blood vessels, while the good cholesterol acts like a cleanup crew, carrying that bad cholesterol away to your liver to be removed. Our main concern is that when there is too much bad cholesterol, it can narrow the vessels that supply blood to your heart and your brain. Does that explanation make sense to you so far?
It makes sense, but it is quite scary to hear that my blood vessels might be getting blocked. I always thought I was relatively healthy, so seeing high on the paper was a shock. I didn't realize there were different types that worked against each other. Is this something that I've caused myself, or is it just something that happens as you get older?
I hear your concerns, and it's important not to blame yourself. Many factors contribute to these levels. Mihiraa, to help me get a clearer picture of your specific situation, I would like to explore your background and current habits.
Well, regarding my background, my father did have a heart attack in his early 60s, which does worry me now. Now, about my diet, I suppose I do eat out quite a bit because of work, so there's probably more fried food and butter than there should be.
Mihiraa, I'd also love to hear about the physical exercise and social habits, smoke or drink alcohol.
Well, regarding my background, my father did have a heart attack in his early 60s, which does worry me now. Now, about my diet, I suppose I do eat out quite a bit because of work, so there's probably more fried food and butter than there should be.
Additionally, do you have any other medical conditions like high blood pressure or diabetes? And are you currently taking any medications or supplements?
I was told my blood pressure was a little bit high last year, but I'm not on any tablets for it at the moment, and I just take a multivitamin occasionally.
Thank you for sharing those details with me, Mihiraa. It's very helpful to know about your father and your busy work schedule. Since we've identified these risks, I want to explain why it is so important that we manage high cholesterol now rather than leaving it untreated. When bad cholesterol continues to build up, it leads to a process called atherosclerosis, where the arteries become hard and narrow. This significantly increases the risk of serious complications such as a heart attack or a stroke because the blood can't flow freely. It can also lead to peripheral arterial disease, which affects the blood flow to your legs. Our goal is to prevent these issues before they start.
Hearing about heart attacks and strokes is definitely a wake-up call. I didn't realize it could affect my legs as well. It sounds like a very serious situation if I don't make some changes. What can I actually do to stop this from getting worse? I'm ready to listen to whatever I need to change.
I truly appreciate your readiness to take action, and the good news is that there are several initial treatment options focused on lifestyle changes that can make a profound difference in your cholesterol levels. We should begin by looking closely at your diet, specifically by focusing on reducing saturated fats, which are commonly found in butter, lard, and fatty cuts of meat. In their place, we want to focus on increasing your intake of soluble fiber from oats, beans, and lentils, as well as plant sterols, which are natural substances that help block your body from absorbing cholesterol. Regular physical activity is also key because it helps raise your good cholesterol while lowering the bad variety. To make these dietary changes feel less overwhelming and much easier to maintain, I recommend trying structured meal planning on the weekends so you aren't forced to grab convenient but unhealthy options when you're tired after work. It is also incredibly helpful to get into the habit of reading food labels at the grocery store to spot hidden saturated fats and high salt content that you might not expect. Adopting healthier cooking methods can be a game changer as well. For instance, you can try grilling, steaming, or poaching your food instead of frying it in oil or butter. I would also strongly suggest keeping a detailed food diary for at least a week because it allows both of us to see your current eating patterns and identify the easiest areas for improvement. I want to be mindful of your lifestyle, so I would love to explore any specific concerns you might have about making these changes. Does the idea of tracking your meals or changing your cooking habits feel manageable? Or do you see any particular obstacles that might make this difficult for you?
I think I can manage the food diary and maybe the meal planning on Sundays. My main concern is that if I do all of this and my cholesterol stays high, what happens then? Will I have to be on medicine forever?
It is completely normal to worry about the long term, and it's okay if progress isn't perfect right away. Regarding your question, medication is usually considered if lifestyle modifications alone aren't enough to bring the levels down to a safe range, or if we feel long-term management is necessary due to your family history. While these medications are very effective, we would monitor you closely for any potential side effects. For now, let's focus on the lifestyle changes first. I would like to book a follow-up appointment with you in about 6 to 8 weeks to review your progress and see if these changes are sufficient or if we need to discuss medication further. Would you like to go ahead and schedule that follow-up now?
Yes, let's book that in. Having a deadline might actually help me stay on track with the food diary and the exercise.
Thank you. I'll book a follow-up appointment so you have a clear deadline to keep your food diary and exercise routine on track.
Yes, thank you, Larry. I feel a bit more in control of the situation now.